Now we are on the abdomen. So first, we're going to place the client in a supine position with the knees and the flex over a pillow, and we're going to, so the hands is at the side or else it is across the chest. So we're drape the client from the xiphoid, and then also process to the symphysis pubis to expose for the abdomen. This is to promote for the relaxation of the patient's abdominal muscles. So we're squeeze lang ma. Saka ka ma'am ha. Tuyo ka naman. Sige lang ma'am. Dahil ka lang ma'am. Tapos ma'am, so after that, we are going to inspect for the abdomen. But before we inspect, we're going to first have the patient expose the abdomen part. So ma'am, i-expose na ang sa tiyan. Malapit okay lang ma'am. So we're going to inspect for the abdomen. We're going to note for the contour, symmetry, and observe for the peristalsis, the pulsation, the scars, and stray on muscles. So as I can see, it is symmetrical, and it is also doesn't have any scars, and the contour is flat, round, and bilaterally, and it is symmetrical. So the umbilicus is repressed beneath the abdominal surface. So after that, we are now going to auscultate for the abdominal quadrants. So we're going to use a diaphragm for the stethoscope and the bowel sounds, which is the high pitch. So we're going to start it in the right lower quadrant, to the right upper quadrant, to the left upper quadrant, and to the lastly into the left lower quadrant. So the high pitch of the sound, it will heard every 5 to 15 seconds rather, and it is intermittent gurgling sound in all of the quadrants as a result of the air and also the fluid movement into our in the patient's gastrointestinal tract. So the the vowel sound should be always heard in the ileocecal valve area. So we're going to auscultate it. So ma'am, i-auscultate ko lang po yung dito niyo po, left, right lower quadrant, right upper quadrant, left lower quadrant, upper quadrant, and last in the right upper quadrant. Okay lang po ba ma'am?
Sa sundan mo ko eh, lagan. Para na ano yung mga ano pa, kape, nung kusog ka kumunta. Kusog ka duli ba?
And we're going to observe it in the 1 full minute. So there is gurgling sound that we have heard in the gastrointestinal tract.
Sa labor daw? Eh, tulad sao? Bago namin tulog ko, muraw ko. Tulog yun, tulog eh. Dapat hindi ka matulog yan.
Now we are on the right
Siwa ka na, tulog? Si Prangge lang? Ha? Ba't di ka matulog? Si Miles ka tulog? Ha? Lapit na ako, wala ko kaya mas strong niya lang, guro kong alak ko ah. Guro kong wala ko, magkapalalo kami na, dami siguro, hindi yan, ako yun ba? Ito na?
and then we are on the left upper quadrant. So we're going to auscultate it for 1 full minute. So there is I have heard some gurgling in the gastrointestinal tract.
hindi pa kami na mag-class.
And lastly, we have in the left lower quadrant.
Sige, kalapat ibang trabaho. Sige ako. Ang mga pwede yung kalapat.
Grabe kayo kila ko lao. Sitawa na bro. Walang guru sila lang ay ano mo. Down din sa ralat. Bisa ka lutot. Sa tesis, wala sila ba. Lockdown guru ka pa sila lingaw sa katres man dito ba. Gusto nila maglagaw guru ng ulo.
Ma'am, okay na po ma'am. So, after that, so the high pitch sounds is heard into 5 to 15 minutes, and then I have observed that there is a movement, or it is a gurgling sound in the 4 quadrants, which is the result of the air and also the fluid movement in the gastrointestinal tract. So the vowel sound will always be heard to the ileocecal valve area.
Paano ba ganon? Ibalik ko lang yun, mapatres
So,
ka, tres campos mo.
now we are now going to after that we have percuss the 4 quadrant. We're going to now after that we have done auscultating the 4 quadrants. We are now on the percussing of the 4 quadrants in systematic fashion. So we're going to begin with the percussion in the right lower quadrant, and then in the right upper quadrant, the low upper quadrant, and the left low quadrant. So, and then we're going to note for the timpani and the changes of the tones. So, we're going to check. So, ma'am, ano naman tayo, ma'am, mag-percuss naman po tayo. So, sige. Masakit po ba, ma'am? So make sure that you have start in the right lower quadrant, and then the right upper quadrant, left upper quadrant, and lastly in the left lower quadrant. So as I have percussed, I have observed the tympani on the air of the stomach and also the intestines. So the dullness is being heard over the organs or liver of the patient. So after that, what we're going to do is we're going to perform a light and also the deep palpation of the abdomen. So it should be feel smooth with consistent of the softness, and then the abdomen should be smooth, non-tender, and it doesn't have any masses, and it is also easily to palpate and lower. So ma'am, ipapalpate ko lang po siya. First ma'am, light lang po, tapos deep palpation ko po. Hindi po siya masakit, pero pag may ma-feel po kayo na masakit, sabihin niyo lang po sa akin. So, ito po ma'am, masakit po ba ma'am? Then, dito po ma'am. Then, dito po ma'am. Then, ito po ma'am. So ma'am, maggamit naman po ako ngayon ng deep palpation. Sabihin niyo na po ito masakit. Ito po ma'am. Then, dito po ma'am. Then, dito po ma'am. Ito po ma'am. So as we can see, the client says that it is not tender, and also it doesn't we perform the deep and also the light pulsation, so it is not tender. So now we are on the legs, feet, and also in the toes. But before that, we are going to first get the pillow under the patient's knees. So ma'am, kunin ko lang po yung pillow dahil sa knees niyo po, sa under the knees niyo po. Okay lang po ba ma'am? after that, we are going to observe for the muscle of our patient. But before we are going to observe, we're going to ask the patient if it is okay to expose the leg part and also the feet. So, ma'am, okay lang po ba expose natin po yung feet part and to sa legs niyo po? Kasi po, mag-assess po tayo ngayon. So now that I have exposed it, we're going to observe for the muscle. So the muscle, the muscle should be symmetrical. So as I have observed for the muscle of the patient, it is symmetrical. After that, we are going to palpate for the legs and also the feet of our patient. So note that it is normal if there is no pain, heat, swelling, and also the nodules that are present or noted on the patient. So, ma'am, ipalpate ko lang po yung legs nyo at saka yung feet nyo po. Pakisabi na lang po if merong masakit na nararamdaman. Okay lang po ba, ma'am? Sige. Masakit po ba, ma'am?
Hindi.
Dito po?
Hindi.
Dito po, ma'am?
Hindi.
Dito po, ma'am?
Hindi.
Dito po?
Hindi.
Dito po, ma'am?
Hindi.
Dito po?
Hindi.
Okay. So, as we observe, as we palpate for the legs and also the feet of the patient, there is no pain. And there is no swelling and nodules that are noted. So we're going to palpate it with the back of the hand if the heat is. So as we palpate it, there is no normal since both of the heat in the patient's legs and also in the feet are symmetrical and it is normal. And after that, we're going to test for the muscle strength of the legs. In testing for the muscle strength of the legs, we're going to ask the client to move the extremity or different extremity to the full range of motion against the resistance. So we're going to do this by applying some resistance against the part that is being moved. So normally, the scored is it as +5 if active motion against the full resistance. So, ma'am, ang gagawin niyo po ngayon with your both of your legs, pupunta lang po siya, ganyan lang po sa side, tapos with resistance po, dito rin po sa side, tapos mamaya, ano po ako para magbigay po kayo ng range of motion. So, ma'am, sige ma'am, sa kabila po. Sige po. Sige dito naman po, ma'am. Ma'am, ngayon meron na po dito. Tapos, sige po, ma'am. Sige po. The other side, ma'am. Okay, so as we have tested, the patient have applied it with the full of the resistance. So we score it both of the legs as +5. And then what we're going to do is that we're going to palpate for the joints of the hips. So the iliac crest are symmetric in the height and also this is stable, it is non-tender, and there should be no crepitus that as we palpate it. So ma'am, ipalpate ko lang po yung hips ma'am sa joints niyo po. Pag may sakit po kayo nararamdaman, sabihin niyo lang po sa akin. Eto ma'am, masakit po ba ma'am?
Hindi.
Dito po ma'am?
Hindi.
Okay. So as we observe, the patient is stable, hips are stable, and also the patient says that it is not tender. And also as I have palpate there is no crepitus located present. So after that, we're going to test for the range of the motion of our hips, of the patient's hips. So we have the 90 degrees and also the 120 degrees. So the 90 degrees of the hip flexions with the knees that is straight, and then for the 120 degrees, the hip flexion with the knee that is bent to the other leg that is remaining straight. So ma'am, ngayon po, gagawa pa tayo ng 90 degrees, ganyan lang po, pataas, tapos ganyan, magbigay ako ng ano po mamaya, tapos ano po siya. Sige ma'am. To the other side, ma'am. Pinakamataas niyo po na magawa. Sige, dito naman po, ma'am. Sige, to the other side. Ma'am, mag-perform naman po tayo ng 120 degrees, which is yung isang leg niyo po, naka-straight lang po, then isa, naka-bend po siya. Kung saan niyo po makakaya. Ganyan. Sige po, ma'am. Huwag niyo lang po awakan. Sige. Sige. To the other side naman po, ma'am. Sige, ma'am. With resistance na po. Dito po. Sige po. To the other side. Okay. So, as we can see, it is normal since the patient have a range of the motion. So, after that, we are going to palpate for the knees of our patient. So, in palpating the knees, it should be symmetric. The hollow are present on both of the side of the patella, and there is no swelling that is present, and also the deformities. So, the lower leg of the in alignment with the upper leg. So, we're going to palpate. Ma'am, ipapalpate ko lang po yung knees niyo po. Ma'am, sabihin niyo lang po if masakit po o hindi po. Sige. Masakit po ba, ma'am?
Hindi.
Dito po.
Hindi.
Dito po, ma'am.
Hindi.
Dito po.
Hindi.
Okay. So, as we have observed, there is no swelling, there is no deformities, and also the lower leg is aligned with the upper leg. So, it is normal. After that, we have done it. We're going to palpate for the ankles of our patient. So, there is no pain, heat, swelling, and also the nodules that are noted. So, we're going to palpate it. Ma'am, ipapalpate ko lang po yung ankle niyo po. Okay lang po ba? If may masakit po kayo nararamdaman, sabihin niyo lang po sa akin. Ito po, ma'am. Masakit po ba, ma'am?
Hindi.
Ito po.
Hindi.
So, as we have noticed, as we palpate it, there is no, it is not tender, non-tender, and also there is no pain present in the patient and nodules that are noted. So, after that, we are going to assess for the capillary refill. So, the capillary bed refill should be, the color should be returned in less than 2 seconds. So, we're going to check. So, ma'am, iyan ako lang po yung capillary. To the other side naman po, ma'am. So, as we observe, the color have returned before the 2 seconds and it is normal. So, after that, we are going to test for the sensation, which is the dull and also the sharp sensation. So normally, the client can identify the or stimulate for the sensation, which is the dull and also the sharp sensation. So we can the client can point where is the sensation being assessed. So ma'am, gamit po tayo ng sharp sensation at dull sensation. Ito po yung dull sensation, ito po yung ma-feel nyo, at ito po yung sharp sensation. So ma'am, if the client, we can have the client close her eyes or open it. So is it okay to open the eyes of the client since it is farther away from the area? So ma'am, pakisabi lang po if dull or sharp. Ito po ma'am, dull. Paki-point po ma'am kung nasaan. Okay. Ito po,
Sharp.
paki-point ma'am.
Dull.
Paki-point din po ma'am. Okay. Balik lang po natin ma'am ha. So, after that, we have done it. Normally, the patient can know where is the dull and also the sharp sensation located. So, after that, we are going to perform the heel to toe shin test. So, we're going to have the patient heel or the foot down to the shin of the opposite legs. So, we're going, so lower extremity movements coordinated, and the right side or the dominant side is slightly coordinated rather than the non-dominant side. So, ma'am, magpa-perform po muna tayo ngayon. So, ang gagawin niyo po, ganyan nyo lang po with your other feet. Yan. Tapos sa kabila naman po. Sige, try niyo po mag-isa. Sige po, try niyo po. To the other side naman po. Okay. So, as we observe, the patient have done the test, and it is both of the leg are incoordinated. So now we are going to secure the gown of the patient and assist the patient on the standing position. So this will maintain for the patient's integrity, and also it will prepare for the next procedure that we have going to do with the patient. So ma'am, paki-assist ko lang po kayo, tatayo pa tayo. Sige po ma'am. Wait lang po ma'am. Sige po ma'am, upo lang po tayo ma'am. Sige po. So now we are on the musculoskeletal or neurological system. So we're going to observe for the spinal curvature, and we're going to check for the scoliosis. So we're going to inspect for the position of the patient, the posture, and inspect for the normal curves on the spine with the patient is standing. So, ma'am, okay lang po ba mag-stand kayo dito? Tapos, magdikit lang po kayo. So, we're going to test it if there is curvature. So, I can see that there is dito, and then meron din dito. So, it is normal. So, we're going to test for the kyphosis and also the scoliosis by having the patient bend. So, mag-bend po kayo, ma'am, na nag-assume kayo na nag-dive kayo. Kaya niyo po ba, ma'am? Sige. So, ganyan. So, we're going to stand behind the patient, and then we're going to inspect and palpate for the spinal curvature. So, normally, there is no spinal curvature, and I can really test that there is the patient is in midline, and there is an patient posture is erect. So, okay na po, ma'am? Sige, tayo na po tayo. So, after that, we have going to observe for the gait. So, we're going to inspect for the patient as the patient walks, and then we're going to note for the patient's posture, the head position, the faces, the toe position, the air spring, the cadence, the coordination, and also the stride, the length, and also the base of the support. So, sige ma'am, lakad po kayo na normal nyo lang po na lakad. Saka balik naman po. So, as we can see that the posture of the patient is erect. It is the head is in the midline. So the head of the patient is in the midline, and also the faces is confirmed, and the weight of the patient is evenly distributed, and both feet are straighting forward. So now we are on to observe for the tandem walk. So it should be balanced and also the intact. So ma'am, ganyan lang po mag-fit ng tandem walk. Sige po ma'am. Okay na po ma'am. And then we are going to have the patient observe in the upping of each leg. So ganito po ma'am. Huwag po muna. Tapos sa kabila, ganyan. So can I see you perform ma'am? Sa kabila naman po. So, the patient is balanced and also it is intact. So the patient can do the tandem walk and also the heel and toe walk, and the patient can perform the knee bend, and also the patient can hop in place without and have a balance. So the abnormal findings, the patient cannot balance it, and also it associated with the cerebellar disorder. So now, the thing that we're going to do is we're going to do the Romberg test. So we're going to have the patient stand together with the feet and also the arms at the side, and then the patient could close the eyes of the patient, and we're going to stand close to the patient in case that the patient will not maintain the balance. So the positive in the Romberg test is the cerebellar disorder, which the patient has difficulty in maintaining the balance. So ganyan lang po tayo ma'am. And then, ganyan lang po ma'am, tapos naka-close lang po yung eyes. Sige ma'am, perform niyo po ma'am. Close lang po yung eyes kung kaya naman. Okay na po ma'am. So as we can see that the patient have maintained the balance in performing for the test. So now we are on perform for the finger to nose test. So in the finger to nose test, we are going to dito ka lang. So we're going to while we are standing in front of the patient, we're going to hold the finger about 12 inches away from the patient and have the patient touch our fingers and repeat at the various position. So, if the patient is can do this, the movement should be accurate, and if the patient cannot do this, it is a inaccurate of the movements which cause for the cerebellar disorder. So, ma'am, ang gawin niyo po ngayon, ilagay ko lang po ang yung kamay ko sa itaas, tapos ilagay niyo lang po yung nose niyo sa ang fingers niyo sa nose niyo and i-point niyo po yung kamay ko. Sige po, ma'am. Sige, point niyo po. Sige, ma'am. Point niyo po. Sige, ma'am. Point niyo po. Okay, so there is a normal finding. So now we are going to reposition the patient to the comfort area. So, ma'am, okay, gusto niyo po ba humiga? Higa lang po tayo, ma'am. Sige. Excuse me. Okay na po ba yung excuse lang po naman. Okay na po ba, ma'am? So after that, so having the patient to the comfort, this is to provide for the patient's comfort and also maintains for the integrity of the patient. And then, the thing that we're going to do is that we're going to perform the aftercare, and we're going to perform the hand washing after that. So it will be prevents for the spread of microorganisms and ensures that the patient is in safe, and also the clean environment of the patient after the patient's procedure. And then we're going to document for the findings of the client's chart. This will provide for the baseline and also the continuity of the care. After that, so we're going to document, and we're going to report for the to the physicians for the any deviation from the normal. So this will ensure that the awareness of the physician regarding for the deviation, and also it will found during the assessment of the patient and also the baseline for further testing of the confirmation for the patient. So that's all for the comprehensive physical assessment part 3, and thank you. Hi.